So good evening, everybody. Thank you so much for joining us tonight. On behalf of FAAEM, RAMS, and the Wellness Committee, we just welcome you to our webinar tonight. We'll be discussing surviving medical training during the pandemic, being well and staying well. Thanks to everyone for joining us both here on Zoom and also live on YouTube. And so without further ado, I would love for our speakers to introduce themselves. And before I do that, I'd just like to say hello to everybody. I'm Wendy Sun. I'm one of the third-year residents at Yale New Haven Health, and I'm also the RAMS president this year. And Dr. Alvarez.
Hi there, Alvarez. I'm one of the faculty at Stanford. I'm also the director of well-being.
Hi, I'm Amanda Deutsch. I am at Stanford, and I'm the Wellness Fellow at Stanford right now as well.
Hey, everybody. I am Dr. Jennifer Kanapicki-Comer. I am an associate professor at Stanford and one of the associate program directors. Welcome.
Hi, everybody. My name is Jeff Sakamoto. I'm a recent alumni of both Stanford and the RAMS board, and I'm currently working in Honolulu, Hawaii with the emergency group.
And for tonight, we have no financial disclosures.
I will say, though, that a lot of the slides we'll be using from Liz and Molly. This is their book. Again, I have no financial disclosures. I just love the slides that they have. Reminds me so much of Ted Lasso. It's like the Ted Lasso of images. And so with that, the path to becoming an emergency physician is not easy, and I don't have to tell you that. Looking back before the pandemic, despite some challenges, I thought I had a good grasp on boundaries. I was able to separate my work from my life. With the pandemic, I'm sure I'm not alone in feeling overwhelmed. Emergency medicine in and of itself is overwhelming. And the rising cases of the Delta variants, the conspiracy theories about vaccinations, the amount of misinformation out there, the list goes on. And we are living in a very challenging time, to say the least.
And to add to all this, our environment in the emergency department is known as a VUCA environment. We work on complex medical conditions with very limited information, rife with ambiguity and uncertainty, and we have no control who's coming to us, how many people show up all at once, with what diagnosis, and so emotions can be high. At any given shift, we counter a burst of conflicts and challenges. Equally important, we need to quickly recover from one patient counter before going to the next. And this happens multiple times during our shifts.
And we also have very high expectations for ourselves. And we're motivated by the fear of failure, as Kristen Neff talks about. This fear of not being good enough, and this fear of missing out on opportunities. And so we're also told that we just simply have to fake it until we make it, right? And somehow there's this nagging feeling that maybe today's the day that we're going to be found out, that we don't belong here, and that we're not good enough to be here. At Stanford, there's also this thing called the Stanford Duck Syndrome. The idea is, if you look at a pond with a bunch of ducks, you can see them just floating serenely in a very nice picturesque environment. The reality is, if you look at each of these ducks, they're all fluttering under the water just to keep afloat. And that's what it's like to be in an environment like the emergency departments, when people are trying to keep it together, when in fact it's really not. And so in the next several slides, let's talk some statistics. Dr. Deutsch, do you want to start us off?
Thank you. Burnout has been studied at all levels of medical training, and unfortunately, we know it starts early. One study found that a little over half of all medical students meet the criteria for burnout, and this looked at 7 different medical schools across an equal mix of all 4 years of training.
Another study of 3,500 second-year residents across multiple specialties showed that 45% experienced at least one symptom of burnout at least once weekly.
And a national survey of 1,522 EM residents in 2017 showed a burnout prevalence of 76%, suggesting that these issues begin in residency training. And emergency physicians report some of the highest levels of burnout, between 48 to 70% compared to other specialties. EM is unique in that emergency doctors respond to unpredictable work demands in a high stakes environment with ever-changing support teams and work schedules, frequent workflow interruptions, and steady exposure to trauma and human suffering. Remember, the VUCA environment. Plus, workplace factors contribute to an overall sense of lack of control and compromised decision-making autonomy.
So while the prevalence of burnout among practicing physicians across all medical specialties is more than twice that observed in the general adult working population, this same physician population actually reported less burnout as medical students at the start of their matriculation compared to their age-adjusted non-medical peers. And so far you've seen that from the very beginning, burnout seems to be present from the medical school to the residency to being an attending. And yet, when they did the study for those medical students at the beginning of their medical school, they were less burnt out compared to the general public. They have higher quality of life and lower rates of depression. And so we need to start working on our own areas to really protect ourselves. At Stanford WellMD, we talk about 3 components required to achieve professional fulfillment. According to the 2016 Stanford Physician Wellness Survey of over 1,000 physicians, WellMD found that physicians with the highest self-compassion have the lowest burnout. Again, let me say that. Doctors who practice self-compassion are less likely to be burnt out. And the opposite is also true. Physicians who were burnt out had the lowest self-compassion. The 2019 study supports this as well. And this is an ongoing work across several other universities now in the country. Now, I'm grateful to work in a place where we have centers like the Center for Compassion and Altruism Research and Education. It's co-founded by the Dalai Lama. CCARE found that teaching self-compassion is actually very difficult. You can read about this in the book by Thupten Jinpa, A Fearless Heart. At the Applied Compassion Training, which is a 10-month intensive on learning the science behind compassion, I learned that it's easier for us to practice self-sacrifice. After all, we're high-performing professionals, and so self-sacrifice got us to where we are now. That was the motivations of fear, right? Whenever we're worried that we're going to miss a deadline, right, we are much more likely to be motivated to get things done. However, this is not sustainable, and we often compromise sleep or even take the time to enjoy our own meals, basic necessities that are important for us to recharge. We sacrifice self-care in order to attend to the many other competing priorities and responsibilities that we have. And so the idea is that developing self-compassion can be done. It takes deliberate practice and it requires boundary setting. So I'll just go over what self-compassion is. According to Kristin Neff, who's done a lot of research in self-compassion, she talks about 3 components of it. The first one is self-kindness. We have to be willing to give ourselves a break. We're not expected to know everything. So for the residents and medical students in the audience, we're not expected to know everything. And even as an attending, I don't have to know everything, right? And yet, despite best efforts, we are bound to screw up. We're not always going to get it right. That's why you're still in training. And newsflash, again, as an attending, medical harm still happens. Missing deadlines still happen. And so we need to be warm and understanding towards ourselves. We have to practice not to ignore our own pain. And I know this is a very hard practice for emergency physicians. We're so good at compartmentalizing. After all, this is what allows us to pivot from one tough resuscitation to another. We have to find moments to be kind to ourselves, even if that means taking a quick break. The second is the concept of common humanity. It's the understanding and knowing that feelings of being inadequate are part of the shared human experience. That just like you, I'm also having moments of doubt, moments of questioning my self-worth. Am I really good enough for this? Do I belong here? These questions are not unique to me, and it's not unique to you as well. These are common feelings that we all experience. And so it's important for us to remember that you're not alone in this. In that, remember the Stanford Duck syndrome. Everybody is fluttering under the water. The third is mindfulness of this self-awareness and being present in the moment. And it's having this balanced perspective to negative feelings. Mindfulness takes practice. We're not over-identifying or exaggerating the feelings that we're experiencing. We're simply noticing whenever we're being tough on ourselves again.
And the next point is that, work-life balance is a myth. Some people even dislike this because it puts work and balance, work and life at odds with each other.
That's a good point, Wendy. Work-life integration may be a good way of looking at it, although some people would also prefer clear boundaries. After all, we're emergency physicians. We work in shifts. Now, I don't want to keep on thinking about our patients when we're on vacation. And we're not really effectively doing our job if we're in the middle of a resuscitation and we're planning our next hiking trip. And so where do we even begin?
Yeah, so let's use the WellMD professional fulfillment model to answer some common questions medical students, residents experience, especially during the pandemic. Let's start with the culture of wellness. Dr. Jeff Sakamoto, who served as our RAMS board secretary and treasurer last year, led the SAEM Wellness Committee study along with SAEM RAMS on burnout and professional fulfillment among young residents.
Thanks, Dr. Sun. So as Dr. Alvarez and Dr. Sun both mentioned, one of the cornerstones to professional fulfillment and well-being, which is in the center of that circle, is establishing a culture of wellness. So how do we do that? And I think more specifically and more pertinent to this study is how do we measure that? So what we did was we recently conducted a survey of SAEM resident members in order to better understand where we currently stand in terms of both burnout and professional fulfillment, and really what the drivers of each of these are. So to give a little bit of a background, I think Dr. Alvarez had mentioned this study already, but Dr. Michelle Lin did a large survey of emergency medicine residents not too long ago, and her study found that burnout was measured as high as 76%, which is very high. So it continues to be an ongoing problem within our specialty. But what we noticed is that most of the prior research really just focused on measuring burnout using instruments like the NASDAQ burnout inventory. And burnout is just one side of wellness. It really does not take into account the more positive aspects of wellness, such as professional fulfillment. And at least to me, burnout and professional fulfillment together provide a more complete appraisal of well-being. Additionally, we kind of found through our literature search that there's not too much research on what the drivers of wellness are. So we sought to answer these questions. So this is the study aim, and we hope to identify the rates of and contributors to burnout and professional fulfillment among EM resident physicians. So briefly, this is our methods. We conducted a cross-sectional national survey study of resident members of SAEM, and the primary outcomes, as I mentioned, were burnout and professional fulfillment. And the way we measured this is a tool called the Professional Fulfillment Index that was actually developed by the Stanford WellMD faculty, and it's been validated as an instrument to measure both of these. The survey also consisted of question domains, examining organizational and individual factors to see if there were significant associations with burnout and professional fulfillment. And to give an example of a couple of these, scheduling, meaningfulness of clinical work, alignment of values, and others. And then we then did a logistic regression to determine if any of the relationships between these domains and the primary outcomes were significant. So what do we find? We had responses from 275 residents, and the burnout rate was still pretty high. It was about 50%, 48%. And to me, the professional fulfillment rate was low at 28%. And I think what was the most interesting from these numbers, I didn't write it down here, but what was the most interesting to me is 54% of residents without burnout in our study also did not report professional fulfillment. So it's not the same. Not being burnout is not the same as being professionally fulfilled. And to me, what that means is we need to track both of these numbers to better understand, have a complete picture of wellness and to measure these outcomes. And all of those domains that we measured were significantly associated with both of the professional fulfillment and burnout, and thus have a significant influence on wellness. And I'll just list them here, but academic work environment, self-compassion, as Dr. Alvarez mentioned, meaningfulness of clinical work, scheduling, EHR, perceived appreciation, values alignment, satisfaction with training, and the impact of work on health and personal relationships. However, what we found through the logistic regression is there seemed to be a recurring theme that meaningfulness of clinical work had the highest odds ratios for both professional fulfillment and burnout. And to me, what this meant is if you want the most bang for your buck, it may be good to implement interventions which focus on deriving meaningfulness. And not to go too much into that, but to me, the definition of meaningfulness is a little bit nebulous, but I think it can be found through the exploration of where physicians find joy and purpose in medicine, driving fulfillment, and focusing on these aspects of clinical practice can increase satisfaction at work and wellness. So where do we go from here? I think the key is we need more research focusing on measuring the effects of implemented wellness interventions using things like the Professional Fulfillment Index. And this will provide us with the evidence base to have data-driven changes to residency wellness curriculum. And I think in turn that can create the culture of wellness for residents early in training, ensuring the future of our specialty. So let's now talk about gratitude. Dr. Amanda Deutsch, the Stanford EM Physician Wellness Fellow, will share her expertise on this topic.
Thank you, Dr. Sakamoto. I think so important that we started to talk about culture and really talk about why we should even be grateful to be training to be emergency physicians or are emergency physicians. We've all gotten to where we are in this path because we can work really well under pressure. We strive to do better even after we receive critical feedback. But these days, it can still seem like no matter what, as you hear all these numbers, that the deck is still stacked against us in our career. And I don't think any of that's changed as we've gone through COVID. So really the question is, what can we do next? I think now it's actually important to think about how we can reframe things to remember to include more positivity in our daily work. Barbara Fredrickson has studied this, and she found that actually a ratio of 3-to-1 in positive thoughts to negative thoughts can make people more open, creative, and actually flourish in their careers. And that's all to say without having to get rid of those negative emotions or experiences as well. I think anyone that's worked a shift with me knows that I still want to have the ability to be stressed or annoyed about something, but that doesn't mean to forget all the positive things we have too. So the next part is knowing that we have to practice gratitude, even as simple as recounting 3 things you're grateful for daily. This is shown to be better than Prozac at 6 months in fighting depression. Brian Sexton was able to prove this by a 2-week intervention where he just asked that people actively practice gratitude and was able to study this and prove this. Now, it's not always a simple task. I know the amount of things that we're juggling while we're on shift, the amount of consults, the critical patients coming in, nurses also asking if we can just feed our patients that all they want is a bite to eat. But even taking some of the time to write down the positive feedback that we get from shifts, whether it's patients, friends, just telling you something about who you are as a person outside of work, and writing them down to flip to on those days that's really hard to come up with a positive is something that can start to help, and something that I have started to practice myself and put in very bright colors. But even that doesn't always feel easy to do, especially with our careers. And as we can see, a study that surveyed over 7,000 emergency residents found that 45% of EM residents have been exposed to some form of mistreatment, whether that's that they've been discriminated against for gender, race, all of the things that could be. And this was something, the survey was conducted in February of 2020, so very recently, and it was after the in-service exam. So in fact, some of you may have actually been a part of this and identified that you've been mistreated previously. It was self-reported, and the options of those we've been mistreated by included patients, even patients' family members, attending physicians, other residents and fellows you work with, administrators, nurses, and other support staff. So in a career where we're constantly already thinking about what could we have done better, what could we have done differently, where we feel that we're mistreated by others and even those that should be our peers and colleagues helping us lift up, how do we stop that cycle of beating ourselves up and mistreating others on top of ourselves, on top of everything else, to salvage that shift so that we can find some of that fulfillment and not go home just dreading the next shift that we have to do? Studies have shown that you can actually interrupt this negative thought cycle by practicing gratitude. So you can actually stop that continuous nagging thoughts that you have. And it's been shown that it actually can decrease anxiety and depression. So this whole idea of stopping the negative thoughts and starting to practice gratitude, and the idea of being grateful or recognized at work, is not a new concept. In fact, one poll found that 65% of people believe they receive no recognition for the work they do. And this is a poll that was outside of medicine, but just in the business world. And the US Department of Labor actually found that this is one of the most attributable reasons of why people leave their careers or jobs and seek a new place to work, this lack of recognition. So what can we do to try to make this huge impact with such a low effort, low cost to everyone? So recognition, and consequently creating a more human workplace, has been studied extensively in the business world. It is found that this actually can have multiple positive effects. In fact, when we're recognized, again, like we just discussed, there's more retention in the workplace. We find that there's increased engagement of those employees that are getting recognition. It also encourages much higher performance from those that are already receiving that. Ultimately, it leads to higher customer satisfaction for those that are receiving this and working with those workers. And lastly, and importantly, it creates this high trust environment that employees want to continue to be a part of and continue to work harder for. So it creates this giant positive feedback loop. One study conducted found that employees who were recognized, 70% were more likely to feel emotionally connected to their peers and happier when they were at home and had left work. So this idea of helping lift everyone up makes me think, what can we do for the future? What can we do to start to make this like how we practice in emergency medicine? And there are interventions we can and must do in the healthcare systems to decrease this mistreatment and work to create a more collegial environment that is able to foster more peer recognition and create a sustainable difference to create this culture shift. One such intervention that I wanted to speak about, because I was able to experience this when I was a resident, is exemplified by Penn High Five. Penn High Five was a web-based application that still is acted at in Penn, launched by Drs. Kat Lee, Ian Oppenheim, and David Doe at the Hospital of the University of Pennsylvania. And they first launched it in their emergency department. They were able to go ahead and connect this, that you had to use your own login information that you would have at the university to be able to use it. And they started to look at what this meant if people were using this as a positive feedback to send. It was really silly memes to congratulate someone, whether it was in the department for doing a great procedure or just helping them out in a tough situation, or even something as silly as my mom one time received a high five because she sent Rice Krispie treats all the way from Iowa to Philadelphia. And I was so excited for my own high five, only to realize it was for Nancy Deutsch, who also was very excited when I called her after her shift. So they looked at this starting in 2016, believing that it could actually make it really easy to have staff, as they sit down to do electronic medical records on Epic or anything else, to also pull up the website and send a quick message, a positive interaction to one of their colleagues, and potentially serve as a tool that could combat burnout. They tracked the usage of this from 2016 to 2019, and they found that it had 99% believed it positively impacted the emergency department. And they were able to show that 88% of residents used it, attending physicians and nursing also used it at that time. So of all those people in the emergency department, of 259 possible users, they had 227 that ended up using this on their own choice. And at the time that they looked at it, nearly 2,400 messages were sent within the emergency department, with each user sending on average about 3 high five messages per year. In fact, they was so well liked that people wanted to know how they could reach out to the consultants that were coming down and being great, or the medicine resident that had just come down to look at the patient before agreeing to the doc and taking them upstairs, and wanting just to acknowledge all of their peers. And at that point in time, they finally opened up high five to the entire hospital. High five, they saw when they asked respondents what it really helped them do. They believed the positive impact was that it created this friendliness among colleagues. 78% believe that. It gave this employee recognition that people were feeling like they didn't have, weren't being seen, a sense of personal accomplishment, employee teamwork, and respect among colleagues. So what I think we can do for this is I encourage you to write down those positive reminders you receive. Keep the emails you receive that flaunt your greatness that you would be too humble to say about. And remember to actually actively see your peers and give them positive feedback as well, even in the little things they do, because we know it can make a world of difference, and we have to start to be the change.
Thanks, Dr. Deutsch. Again, I want to emphasize here that what we're saying is not to ignore the mistreatment and the abuse and all the negative things that's happening with simply being grateful. I think that will just be gaslighting all the negative aspects that we're experiencing. What we're hoping to establish here is by simply practicing gratitude within ourselves, we start to actually see all the good things that are happening surrounding us, instead of automatically focusing on the negatives, because it's so much easier for us to see the negatives. That's how we survive. That's how we're able to recognize the rattlesnake from all the other fun things that are surrounding us, right? We remember all the negative things because it allows us to then avoid that in the future. I really love the study here that Dr. Deutsch was sharing with us, because it also gives us the opportunity to control what we're able to control, which is I can still be mad, I can still be upset with what's happening, and at the same time, be grateful for the things that truly deserve my gratitude. And so with that, I want to just briefly cover the act of setting boundaries, because it is a form of self-compassion. People always, or at least for me, when I talk about self-compassion, they think that it's a passive way of dealing with stress. It actually, for me, is an act of putting my foot down when I don't agree when things are working the way that it should not be working. And so by setting boundaries, you're practicing simply being kind to yourself. Remember, again, that Stanford duck syndrome. Everyone's fluttering under the water, right? So why not set some boundaries in order for you to save your energy? Dr. Kanapicki will then now go through some tips on how to optimize your own time.
Yeah, so before we get to Dr. Kanapicki, we just have a couple questions that we fielded out from residents and medical students, and that I think really kind of breaks down into the efficiency of practice. And so these questions are: A, how do I enjoy my time off when I'm really off and when I have so many things to do? B, how do I set boundaries for sleep and workout? And C, how do I make time for my family and also do well in school?
Dr. Sun, these are such great questions, and so many residents and medical students and faculty as well have. You guys are all working a ton, right? You're spending a large chunk of your time working clinically. You could be attending lectures, studying, and often you feel like you have little time for yourself. There are only so many minutes a day, 1,440 to be exact. And although you might feel at times like the majority of them are spent at work, it's important that the minutes you do have left, you use wisely. Make sure that these minutes align with your priorities and what you value in life. So I want you all to ask yourself this question. Do you know your value, right? Where do you want to invest your time? Where do you want to invest those precious minutes in a day that you have left? And if you haven't asked yourself this, I think now is a great time. One of my favorite time management books is called The Productivity Project by Chris Bailey. Check it out if you haven't read it. And it talks about hotspots. And hotspots are basically the portfolio of your life. So every task, project, commitment can all fit into one of these hotspots. And the book says 90% of us have the same 7 hotspots. And they are mind, body, emotions, career, finances, fun, and relationships. So this book really encourages you to sit down, take some time, write out these 7 hotspots, and what did they look like for you? And this will give you a key to what your values are. And I remember reading that, and I'm sure you guys have been in a similar position, and you're just like, aha, like that aha moment. You're like, yes, like I haven't been planning my week based on my hotspots or my value, right? I've been stuck in the weeds, right? I've been stuck at the end of a shift. I'm just so exhausted. You know, it's very easy just to turn on Netflix, and sometimes that's okay too. But you know, after reading this, I really sat down. I wrote out my 7 hotspots, and I put my personal values under each of them. What did I really want in life? So this is my action item for you. I want you guys to plan, to calendar in the next couple of days, a time to really sit down. And I want you to think about your hotspots. And that's why I have this, you know, bonfire going. You know, go somewhere peaceful. Where's your happy spot, right? Where can you really get a 30,000 foot view of your life, right? Take a pen and a piece of paper, or open up like a note app, write down the 7 hotspots. And then I want you to think about under each one, what does this one mean to you? Just to give you some examples, I always like examples. So under mind, right? Like when I think about mind, I think about, you know, it's important to me to read. I love reading. I love books, right? So I need to incorporate this into my life because it's something I really value. I, you know, really appreciate meditation, and it's something that, you know, I really value having in my daily life. When I think about body, I think, you know what? I really value working out. And even if I can do 20 minutes a day, I'm happy with myself. Relationships, right? This reminds me that, you know, I really value checking with my family members, and I have to remember to do so more routinely, right? I want to make time for my spouse. So do this exercise, right? Take a 30,000, you know, foot view of your life before you get into the weeds, right? Before it's like your 4th shift in a row and you're coming home and you're just exhausted, right? If you do have those precious minutes, you know, you want to make sure that you use them according to when you have that time that you're out of the weeds, what really do you value? So my step 1 is just knowing your hotspots, right? The first step is just knowing what you value, because otherwise you're not going to use your time wisely. My second step is making sure once you know your values to calendar your week. So let's talk a little bit more about that. So to-do lists, right? Like I feel like a lot when I talk about efficiency, productivity, like to-do lists always come up. And I'm sure probably most of you have a to-do list. I want you to ask yourself, how long has items on your to-do list sat there, right? Is it days, weeks, months? Is there some stuff that's been on there for years? Ditch it. I want you to ditch your to-do list. The book that really got me interested in time management was this book by Kevin Kruse. It's called 15 Secrets Successful People Know About Time Management. It's awesome. He runs like his own research lab on time management. And if you know, look at the physician literature, there's really not much about time management. Business world talks about it all the time, but we don't talk about this enough. And so this book has, you know, he has his own research staff, and they found that people with to-do lists, right? Things on your to-do list, 41% of time doesn't get done, right? Isn't that crazy, right? And you know, these things that live on your list, they're stressful, right? You feel bad because you haven't done them. You know, unfinished goals in themselves are stressful. They swim around your brain. You know, you're like, oh, why didn't I schedule that biannual with my PD? Why didn't I log my duty hours, right? So you need to unload your brain, right? Your brain's there to concentrate on the important stuff, right? The cognitive undertakings of your daily life. So I want you to ditch your to-do list. because successful time managers don't have to-do lists. They have a very well-kept calendar. So what calendaring really means is, instead of putting something on a list that you're not going to look at for years later, you're going to calendar it. So if you know you have to submit schedule requests, right? You say, Wednesday at noon, I am taking 15 minutes to put in my schedule request. I have a biannual survey to do for my PD, meeting. I am going to do that Thursday at 2 o'clock. I take my dog to the vet 4 o'clock on Friday. So what this does is, you don't have this list that's not getting done. You actually have everything built into your week, right? This is going to free your mind and it's going to reduce your stress. All right, so let's talk a little bit about calendaring. I have some tips for you to make sure you calendar successfully. The first tip is picking a day of the week to calendar, right? So I really like doing this on a Sunday night. I feel like it's the beginning of the week. It's kind of my time just to again, get my 30,000 foot view of my week. I'm sitting by a bonfire. I'm doing something like very peaceful. And the first thing I always do when I'm sitting down to calendar my week is I review my hotspots. And that is so key, right? You want to go back to that document you have and think about, all right, what's important to me? What am I really going to do with my free time this week, right? Because only if you do this can you actually calendar your week based on your values. So when you have that 2-hour block of free time, right, that unicorn couple of hours, you're going to base your decision on what to do in that time based on your values, right, instead of when you're in the weeds. So maybe, you have a block of time you see, and maybe you say, okay, what's my hotspot? Choose relationship. That's really important to me. I really need some time with my significant other, my family members. So I'm going to plan a dinner, with my family or my partner. Okay. Then you say, okay, my hotspots. All right. I really value undermined. I really value learning. Where can I put that? Oh, you know what? Maybe during my 15-minute commute time home from a shift, I'll listen to that podcast I've been meaning to. Mine's always I'm always trying to learn Spanish. So getting my 50 minutes of Spanish in there, really helps me follow my values. Working out, right? That's always a big one, right? Everybody always has this good intention of working out. Can you calendar even 15 minutes? Maybe you get out of work at 7. Say, okay, when I get home, 8:30, I am going to take that 15 minutes, and the first thing I'm going to do is go work out, right? If it's in your calendar, it's more likely to happen, right? Calendar every minute. I know that sounds crazy, but my, Gmail calendar, which is what I use, has every minute planned from when I wake up till when I go to bed. And that's how you get things done. My second tip is time boxing. And I don't know if you've ever heard of this, but it's a really cool concept. It's really allowing yourself only a certain amount of time to complete a task. And the best example of this is email, right? Email is such a low return task, right? It's not helping us accomplish anything, right? It's not producing scholarship or writing that grant, right? It's low return. So things like that, it's very easy. I know I've done it to get lost in your email. It's 2 hours later and you're how am I still checking email? So time box it, right? Set a timer for 30 minutes. I like 30 minutes 3 times a day, and say, okay, I am doing this for 30 minutes. And when the timer goes off, I am done, if I'm completed or not. And what this does is it gives your brain this sense of urgency. It's not oh, I have, infinite time to go through my email. It says, okay, I got to get this job done. I only have 30 minutes. And then you stop. So think about that in a lot of your low return support tasks, right? Logging duty hours, questionnaires you have to answer. Can you set a timer, give yourself urgency, and not let a task that, you don't really value take up too much of your time. The last tip, and this is just so, so important, is that you just put so much work into calendaring. Now you have to treat all these calendared items as if they're true meetings, right? So don't cave. If someone, writes you last minute and they say, hey, can you, hop on this Zoom meeting? The answer is no. And you might feel bad, let's say, oh no, I'm going to the gym. And if you have to say, sorry, I have another appointment, that's okay, right? That's self-compassion that we talked about. The key to success is just treating every entry, if it's the gym, if it's spending time with a loved one, as true meetings and setting it in stone. So those are my tips, Dr. Sun. I hope they help.
That is absolutely amazing. And I feel so inspired. I think I might just go out and get a calendar so I could, switch from to-do lists to actually calendaring. So thank you so much for all of that. those helpful tips. And now switching gears a little bit, we're going, Dr. Kanapicki is going to talk a little bit about personal resilience. And so our medical students or residents have the following questions. A, sometimes I just have to sacrifice sleep for my rotation. How do I really catch up on that? And B, I'm frequently tired in my day-to-day life. How do I get enough sleep with all the things that I have to do?
Okay, too long, didn't listen. Your take-home point, I'm going to start with that, is never sacrifice sleep. Never sacrifice sleep. That should never be the thing to go on your calendar or in your life. So I do want you guys to like think about this right now. Like, how much sleep are you guys really getting? And sometimes we think we're getting more than we actually do. So sometimes it's good to like keep kind of a little sleep journal. But think like, you get at least 7 hours, you get 7 to 9, you get more than 9, right? A CDC study found that 35% of US adults are not getting enough sleep, right? But we know like adequate sleep is like vital, right? It's vital to your whole sense of well-being. So let's talk about some data. So the American Academy of Sleep Medicine recommends adults 18 to 60 years old have at least 7 hours of sleep a night, right? And this promotes optimal health and optimal well-being, right? So you say, oh, well, I don't know, I tried for that, but, does it really like matter, right? It not only takes a physical toll on your body, but a mental toll. So let's talk about the physical toll. So sleeping less than 7 hours a night is associated with an increased risk of obesity, diabetes, high blood pressure, heart disease, strokes, and mental distress. I mean, nobody wants mental distress, right? So that's physically, and we know that, like the studies are there. What about mentally, right? Mentally, it takes a toll too. So the Journal of Sleep Medicine, Barnes et al. Talked about a well-rested worker makes better decisions and interacts more positively with their colleagues, right? I mean, we want to make good decisions in our job, and of course, we want to have good relationships with our colleagues. So, we kind of know this, so we know that sleep is important, but we still don't get enough sleep, and we really don't prioritize it. So, like the first step, I'm going to break into my tips, but the first step is making sleep a priority and realizing you need to prioritize it or you're going to suffer not only physically, but mentally, right? So let's talk about some tools to get enough sleep. So first is stop all screen time at least an hour before bed. And this is recommended by the National Sleep Foundation. And, I know it's hard, right? Like, I feel like a lot of us, like you get in bed and you're relaxing. And of course you like pick up your phone and you're like, well, my brain's shutting off. I'm like, going to scroll through some social media, right? But we know like the blue light is bad, right? The blue light, these LED screens are emitting, and that's like phones, tablets, computers, right? It does bad things for us, right? Increases cortisol, right? And that kind of makes us more alert. And then it actually inhibits melatonin getting released, right? So then we're not going to fall asleep, right? So it's bad for us. And it's so easy to do. And I understand it. Trust me, I understand it. But you have to find ways to disconnect at least an hour before your bedtime. So here's some tips. Number one, you can put your devices in another room. And if anybody has read Indistractable by Nir Eyal, great book, definitely great book to pick up. He says like, he tries to put it in another room. Like, don't even bring like any phone, tablet, anything in your bedroom. Like, just go hide it somewhere. So you definitely can try that tactic. My favorite is putting my phone on Do Not Disturb. So iPhone users, and I'm sure like Androids will have this option too. You have this bedtime option. So if you go under your alarm app, you'll see it will say like sleep, wake up, and you can actually go into this, and then you can actually edit your sleep health, and you can select a wind down time. So you can make it 45 minutes, you can make an hour. I suggest an hour, and you put in your phone, and that means whatever wind down you select, and like that amount of time before your selected bedtime, your phone is going to go into Do Not Disturb mode automatically. So if like a text from a friend, somebody like slips in, like a call comes, it's not going to disturb you, right? It's not going to break that concentration and cause you to pick up that device that is giving you bad sleep. So think about that. Again, automate this as much as possible because it's hard in the moment to put down that phone. But if you're not tempted by those texts coming up, by those calls coming up, if your phone's in Do Not Disturb mode like automatically an hour before bed, it's really, really going to help. Okay, tip number 2. A study from researchers at Harvard Medical School found that compared to reading a paper book, People who read from an ebook before bed took longer to fall asleep, had delays in their circadian clock, suppressed levels of melatonin, and had less RAM sleep, right? And then the next morning they were not as alert. So, I mean, that sounds horrible, right? I mean, who wants that? So I feel like this is like a great tip. Like, again, a lot of us, and I am also like guilty of it. I always like struggle between like, you know, having like a book on my Kindle or a paper book, and this like sent me over the edge, like paper books now from now on. So, you know, think about your wind down routine at the end of the night. Think about getting a paper book, right? Again, the data is there that these like ebooks, although like super nice, efficient, a lot of books in one place, they're not helping you sleep and they're not helping you be alert like the next day. So think about investing in a paper book. Lastly, I think it's like developing your own routine, like what works with you. And sometimes you have to experiment, right? So it's just developing, your body wants a wind down routine. It wants to know, you know, what's next. And then I know I'm going to bed, right? So research says dim the lights. And I actually try to do this like an hour before bed. I'll like try to dim all the lights in the house, like, you know, stimulate my melatonin. And then I actually use an app. And I know LA is well familiar with this app. I use Headspace and also Insight Timer. And Headspace I really like though, because they have these sleep casts. And they're like these little stories that just like put you to bed. I go into this like la la land and they're just amazing. And it just like winds me down. I also use a diffuser and I get this like good night essential oil and I put it in there. I know this, you know, just try it. And it's this nice smell and all these associations I have with sleep. And so when my head hits the pillow, I go to sleep. So again, in summary, if I have to tell you more on this, a good night's sleep increases your ability to complete cognitive tasks by 50%, right? So that should be like drop the mic, all that needs to be said. Sleep is just so, so important. So in summary, I only had a little bit of time and I have so many pearls for you. If you want to check out more of just, you know, really good efficiency, time productivity tips, this is the QR code for my blog, 1440 Doctor. It's on Medutopia. But next week, I am launching on Allium, and I am starting the 1440 Doctor series there. Next week will be a blog on how to work from home, because, you know, this is our new practice environment, right? A lot of us are now at home more than ever, and, you know, we need tips for how to be efficient. So check it out. Thanks, Dr. Sun, for those great questions.
Thank you so much, Dr. Kanapicki. I love all of these tips. I can listen to this over and over again, and I know I probably should be applying many of this. And I hope that today I'm gonna like learn more about calendaring. I just wanna also take this moment to again emphasize the idea of understanding our locus of control. Because as emergency physicians, we're trained to diagnose and fix things. Having a healthy understanding of what is within our sphere of influence and what is not can actually really help us set boundaries. This will allow us to disconnect when we have to, versus trying to just see as many patients as we can, even though there's no room for them. I know we want to try, but you cannot burn yourself out to try to take care of another, to take care of the waiting room. You can't do it all as well. You're just as human as each of us here. And just like me, you need rest and sleep, as Dr. Kanapicki has pointed out. And just like me, we could all use some help once in a while. And I hope that with the tools that Dr. Kanapicki has shared, you'll finally find some time to take care of yourself. Because taking care of yourself, including your mental health, has a significant potential return of investment. And don't put off opportunities to also reflect and enjoy what's actually in front of you. Often we're so focused on getting to the finish line that we sacrifice so much of ourselves. Just make sure you're actually going to also enjoy the parts of when you reach your destination. And even though sometimes it feels like you're so far away from being done, the power of perspectives can remind you that this time last year, you have learned and developed so much more skills. I mean, imagine pre-pandemic, and then all of a sudden the pandemic happened, all the skills that you've had to learn. How much more will you develop this time next year? And remember, you're not your job. You don't have to identify with your job. There's so many other important aspects of yourself that you can cultivate. And remember those hotspots that Dr. Kanapicki has shared with us.
And also, don't forget to take advantage of the so many resources out there, including SAEM RAMS. You don't have to go through medical school and residency training alone. Join a committee, get involved, and seek a community. And you'll see in the comments of ways you can join SAEM committees. And again, don't forget to ask for help. You don't have to go through this alone. And, you know, from this webinar, as you can see, there's so many awesome, amazing people out there who have just tremendous amount of pearls to give. And, you know, take a moment to also check in with your friends and your family, and most importantly, check in with yourself as well. And remember, we often wait for kindness, but being kind to yourself can start now.
I just want to end this. I hope that if you're inspired to implement some well-being initiatives at your shop, you check out this resource from AAEM, the EM Residency Wellbeing Innovations Hub. It's pretty cool. When I looked into this yesterday, they only have 162 different programs, different projects, different like well-being initiatives across the country. It tells you how much it costs, the frequency of the event, how many people are, how much time you'll need to create it. Feel free to use it. And again, if it works for you, please submit it for the Innovations Hub as well.
And to end off, thank you so much for amazing speakers who are able to join us on this lovely evening. And thank you to the audience members for spending this night with us. And right now we have a couple minutes for questions. So please either type in the chat or feel free to unmute yourself. Earlier today,
we have people from Uruguay.
Yeah, I was going to say that. It seems like we have folks from all around the world joining us. I did get a message earlier on regarding with a question on for residents and medical students, how are there any tips that you have on kind of balancing with saying no to protect your time so that you have time to do all the things that are in your hotspots versus saying yes to an opportunity? Because a lot of times saying yes to opportunities will lead, down to different opportunities that could lead to career fulfillment. So I was just curious, do you guys have any advice on this?
I always like to say a yes is a no to something else, right? And just really think about that. It's really easy, I think, and hard as a med student and resident to and as a faculty member. I mean, sometimes it's hard for me to say no because things sound super exciting, but you only have so many minutes in the day, right? Your plate is only so big. So everything you put on it, something has to go, right? Because there's only so many minutes. So I just think you really, again, if you're asked something, if your gut doesn't say I love this, this brings me joy, that tidying up book that we're all familiar with, you should say no. And you have to be okay saying no. It's okay saying no, right? You want to make sure you spend your time on your values. And if you have to look back and look at your hotspots, because one of the hotspots is career. So you put under your career, what do you value? What are you looking to accomplish in your career, in your life? And if it doesn't align with that, then you just have to be okay saying no.
I will add as well that meeting with your mentors will be very helpful. So when you know these hotspots, talk to your mentors, because they will be able to also sponsor you and talk about oh my gosh, Jeff is very interested in this, or Wendy is very interested in this, and they will find opportunities so that they can fill that tank, which means that's all the other tank that maybe you're not as interested. You can say no because wait, my mentor told me to do this one. So use your mentor as an excuse. I use my vice chair, I use my mentors as an excuse sometimes to say I love this idea, but right now I'm focusing on this project. And that is true. It's not like you're lying. It really is just more of values alignment. The more aligned you are with opportunities, the more you're excited about it, the more you're going to be innovative, and the more that you're actually going to likely finish that, as opposed to signing up to a bunch of stuff, put in your to-do list, and then it just gets piled on to this next week, maybe I'll tackle this. So for me, I think what I've learned is to socialize a lot of these things that I truly value so that people will know like, oh yeah, LA really want to do this. And so when opportunities come up, they're also going to be able to reach out to me to include me. And they're also going to be watching out for many other opportunities for me to be included. So that will be my addition to what Dr. Kanapicki has shared.
And the last thing I'll piggyback on that is it's a strength to be able to say no too. I think people get afraid that it's going to make you look weak or you're not willing to be that team member to do something. But knowing that you don't either get as excited about it or don't have the time right now is just a strong thing about yourself as well.
Ooh, Dr. Deutsch, you inspired me about another idea that I learned from, I believe, Dr. Adair Landry. When I say no, I try to think of other people that would have enjoyed this opportunity because I may just be the wrong person for that. And so then I sponsored it. I was like, ooh, I don't have the expertise about this, but Dr. Kanapicki definitely loves this kind of work, and then allow her to say no to them. But I think for me, that's another way of like saying no, offer them different options and who else might be the right person to do it. Any other questions? I love this group. I'm waiting 7 seconds. Otherwise, we will give you your 3 minutes back. And really, truly, thank you to Dr. Sun for really leading this webinar. Thank you. I'm so excited to work with you at SAM RAMS. And thank you again for my co-presenters. I really, truly appreciate having this moment in time to spend with you on this important topic. And thanks for all of you who attended here in our webinar, and also for those who are just watching on YouTube, not just watching YouTube live, but is able to watch it like on YouTube or Facebook. Thank you again.
Thank you all so much. And thank you.